Well, welcome back to Find It in Fergus Falls. I am here with Randy Fischer, a man of 1,000 hats. I should have kept the little witch hat, from the trophy here. Well,
What's that
you're not
supposed
a
to
witch,
mean?
but you have so many things going on. And of course, it is Frostbite Festival weekend. And one of the annual events is the broomball tournament. And the
That's right.
Ringdahl ambulance crew has always had a team in that. And thank goodness.
And we have a
Thank
team.
goodness you're there.
We have a team. Yes. Thank goodness we're there, because just in case somebody gets hurt, like an old man falls, breaks a hip, something
Well,
like that.
some people might be overexerting themselves, and things happen, and it's a good thing to know that there's the Ringdahl crew is there. Of course, if you should ever be in a situation like that, how important is that first call to 911?
Absolutely. And it's funny that you bring that up, because that's
It is funny, isn't it?
that's what our conference is coming up on February 14th is all about. It's that whole continuum of care. And I think that's what I'm here to talk about.
Well, that's one of the things. And we want to, of
One
course,
of
wish your team and all the other teams in the broomball tournament good luck. And
Thank
as
you.
we plan February.
I think I'm playing.
Yeah,
But I don't know. I don't know if I made the
So
cut.
I'm guessing you haven't done your qualifying rounds or anything yet.
Well, we did, but not a lot showed up for the practice, and and it wasn't a real rigorous practice.
No, you don't want to overdo it. Save it
No,
for the game.
no,
And just
it
like the
was-
Super Bowl, save it
We're
for the
going
game.
to bring it on for the game. so,
Awesome,
yeah.
awesome. Well, you guys have your is this now like the second or third
This is
annual
our third-
Topics in EMS?
Third annual Topics in EMS Time Critical Calls Medical Education Conference here, hosted at the Bigwood Event Center in Fergus Falls, February 14th. It runs from 8 to 5. Participants receive 8 hours of continuing education, continuing medical education credits. So if you're nursing, if you're physicians, PAs, nurse practitioners, paramedics, EMTs, first responders.
So really anyone in healthcare, or even if you were a child care provider or any of those things, it is continuing education, and it's 8 hours of credit class.
Absolutely. 8 hours for $50, and a nice lunch and breaks and all the materials, and a great lineup of presenters. Dr. Saprell from the Twin Cities area is going to start out the day with a talk on dispatch-assisted CPR. So when we're
So
talking,
what do you mean by that?
well, when we're talking about somebody that goes into cardiac arrest, or somebody that's having an emergency and they dial 911, every second matters. So if we can have the dispatchers, the emergency 911 communications personnel there at the Ottertail County Dispatch Office, talk you through what needs to be done before the ambulance, before the police arrive, that is an important part of the continuum of health care that we can provide. It helps more people survive. If we can teach you and talk you how to do hands-only CPR,
Sure.
if we can teach you to open that airway, if we can teach you to control that bleeding, or just what to do until the ambulance arrives, calm you down a little bit, that's important.
And so the 911 call is not just to dispatch personnel, it's to help the situation.
Absolutely.
And as you mentioned, every second counts.
Every second counts, and those emergency communications personnel there at the Ottertail Dispatch Center are so critical to assist you in calming down, to find out what the emergency is, and then sending out the appropriate help.
And that's just one of the speakers that you'll have is talking about that. What are some of the other? I was reading through the agenda, and it's really interesting, really cool stuff.
Starts the day out. They're all time critical calls, and we start out with the dispatch. We then go into the cardiac arrest. So everybody's talking about hands-only CPR and what you can do, and how to use an AED, an automatic external defibrillator. This is geared more towards the medical personnel. So
Sure.
it's care beyond the initial response, but it also we want to talk about the important role of the bystander, the coworker, the family member, to start CPR. But then we talk about the cardiac arrest, the cath lab, what kind of research is being done out there, the new American Heart Guidelines that will be coming out in 2015 in the fall. Kim Harkins is coming from the Minnesota Resuscitation Consortium. Talk about STEMI and heart attacks. STEMI is a type of a heart attack. It's an ST elevated myocardial infarction. That's
Wow.
what STEMI stands for.
Yeah, it's a good thing it's broken down into just STEMI.
Well, STEMI, it's an easy way to say it, and it talks about how and why it's important to recognize that early, and how important it is to get them to a cath lab then.
Okay.
So we talk about trying to figure out how ways that we can shorten that amount of time from the onset of the symptom until we until you arrive at the cath lab. That's what's going to predict the best outcome for the patient that's having a heart attack. We talk about stroke cases and successful stroke cases. We talk about pediatric pain management. We've got Children's Hospital of Minneapolis or Minnesota coming up for that. The Minnesota Poison Control Center is coming up and going to be giving a presentation to healthcare workers about the poisons out there, the drugs in America.
Boy, and that's changed.
Oh my, yeah.
Changes quite rapidly too.
Dr. Greg Smith from Fergus Falls here, the coroner, is going to be talking about the pathophysiology of why patients sometimes live and sometimes die from their injuries. So fascinating talk for healthcare workers.
Absolutely.
Probably
yeah.
not for everybody.
Well, I think so. I mean, we're all interested in things like CSI. Well, a lot of us are kind of hooked
yes.
on watching that. So there's a little, this is the reality tie into it with Dr. Greg Smith. Great guy.
And then we close it up with Allina Medical Transportation. Kevin Miller is the one of the senior directors of Allina Health. And he's going to be talking about getting home safe and about the important role of the emergency vehicle operators, whether you're law enforcement or fire or ambulance, the important job of actually operating that emergency vehicle and getting home safe and how you respond. And they're going to talk about one of their unfortunate incidences where they had an ambulance crash that was hit by another vehicle. And so we're going to talk about that. Fantastic conference. emsed.eventbrite.com is where you can go to register for the conference, and you need to be registered by February 8th so that we can guarantee meals and guarantee all the materials. You can register at the door also, but we need to have a count for lunch and that kind of stuff
Absolutely.
by the 8th. So.
Well, yeah, the pasta buffet at the Bigwood Event Center, got to make sure there's enough of that. So
Oh, their
they do a
food is
great
fantastic
job.
out there.
I know.
Speaking of food, we've got a banquet that evening too. The Sudden
Yeah.
Cardiac Arrest Association group. We're going to host the second annual banquet for that, and talk about food. We're having a boursin chicken
Oh, that's really good. I've had that out there.
and asparagus wrapped beef or beef
Yum.
wrapped asparagus. I don't know, something. But boy, it sounds good. It sounds great.
They do a fantastic job out there at the Bigwood Event Center, and this is your second annual Survivors Banquet.
It is.
Who can go to this?
Well, anybody can come. Everybody should come because it's supporting the Sudden Cardiac Arrest Association, a national nonprofit organization that we happen to have one of two of the chapters in Minnesota. So
Great.
there's Otter Tail County or Northwestern Minnesota chapter, and there's also a chapter down in the Minneapolis, St. Paul, Rochester area. It's an advocate group. It's a group that supports the importance of CPR and getting AEDs out there and allowing everybody to be trained in how to use an AED. Talking about what helps patients survive a sudden cardiac arrest out of hospital. Looking at the research, looking at the care. And these are all people. Last year we had 19 survivors that attended. And these are all people that were literally dead 1 minute and alive the next because somebody like yourself started CPR, used an AED, and saved their life.
That's fantastic.
So.
And this is for the survivors and their family members and folks that want to support this great group and to
rescuers.
help continue that. Exactly. Continue that stream of information.
Absolutely. We want the survivors, the rescuers, the paramedics, EMTs, law enforcement. There's so many law enforcement saves out there right now because we've got AEDs in the law enforcement vehicles, and they're not afraid to use them and jump right in there and help that because they know how important the speed or the time is in saving somebody like that.
Time sensitive.
Absolutely. Time critical.
A lot of great information, Randy, that Ringdahl Ambulance isn't just here to save people and those things, but you're out educating many people in the community. So thank you for all the hard work that you do in pulling together conferences such as this, third annual Topics in EMS. Critical Time Calls is the theme this year, and Saturday, February 14th is the date. Of course, we have information on the Chamber's website on this, but all the registration information is available online as well. So great event, great banquet that night.
Yep.
Great way to celebrate Valentine's Day, too. take
Good.
care of your heart, right?
Absolutely. It's all about the heart.
Well,
so
I wish-
Come
I
on
hope-
out, join us at the banquet. or
Should be a
join-
great time.
Join us at the conference. Get registered.
And good luck to that Ringdahl team. Hopefully you guys take home that fabulous trophy again
And
this
hopefully
year.
we all are walking afterwards.
Absolutely.
So that's good.
Thanks again. You come back again when you've got more things to share with us.
Very
Always
good.
always great information for everyone.
Thanks.
We'll be back after a short break.